Today, I'm going to tell you about tomato flu.
Recently, a correspondence letter was published in the journal Lancet in August 2022, which claimed that a new viral disease has emerged in India in the state of Kerala in children less than 5 years of age. This disease was first recognized on 6th of May 2022, and the cases have been reported from the state of Kerala and also from Tamil Nadu and Odisha. The disease is reported to be very contagious in nature. The symptoms of the disease have been described as fever, high grade, fatigue, body ache, and rashes. The rashes appear in the form of red, painful blisters throughout the body, especially in hands, feet, and oral cavity. The size of the blisters gradually increase to the size of tomato, and hence the name tomato flu has been given. Other flu-like symptoms like joint pains and gastrointestinal symptoms have also been described. But as the disease is being explored further, it is now recognized that it is not because of a new virus, but is due to a new variant of an already endemic disease called hand, foot, and mouth disease. Hand, foot, and mouth disease is most commonly caused by Coxsackie virus A16 or enterovirus A71. Other strains of Coxsackie A virus, Coxsackie B virus, or ecoviruses can also cause the same disease. In fact, one case report of tomato flu virus have isolated Coxsackie virus A16 from its two patients. The usual hand, foot, and mouth disease is a mild illness with an incubation period of 3 to 6 days. The disease is characterized by low grade fever and appearance of rashes, which can be maculopapular or vesicular and sometimes pustular in hands and feet most commonly, but can also involve buttocks, groins, and other body parts. It also involves oral cavity, especially tongue, buccal mucosa, posterior pharynx, or hard palate. The lesions in hand and feet are usually on the dorsal surface but can also involve palms and soles. The lesions are around 3 to 6 millimeters in size and are painful. The disease usually resolves in 1 week. The disease is transmitted from one person to another by coming in contact with the patient's fluid from the blisters or his oral or nasal secretions or respiratory secretions. Coxsackie A6 subgroup is responsible for its severe variety, which is associated with pain and dehydration. The same subgroup has also been associated with a characteristic feature called onychomediasis, in which the nails of the patients shed after a few weeks of the disease. The disease is usually self limited. Some patients can develop dehydration or some complications like encephalitis, meningitis, myocarditis, acute flaccid paralysis, pericarditis can rarely develop. Treatment is usually supportive. Frequent hand washing and avoiding contact with infected patients can decrease the risk of transmission. I hope this was informative. Thank you.